Good afternoon. Today is April 21st, and today I'll continue to be talking about the coronavirus. So the first piece of news that I like to talk about is that the FDA today said that it had granted emergency clearance to the first in-home test for the coronavirus, a nasal swab kit that will be sold by LabCorp. The agency said that LabCorp has submitted data showing that the home test is as safe and accurate as sample collection at a doctor's office, hospital. Now, experts are saying this is a more convenient and reliable option for patient sample collection from the comfort and safety of their home, according to the FDA commissioner. So, patients will swab their own nose using a testing kit sent by the company, and then it will mail it in an insulated package back to the company to be tested in a laboratory processing. This test will be available to consumers in most states with a doctor's order, according to the agency. LabCorp said that it would first make tests available to healthcare workers and emergency workers who may have been exposed to the virus or have symptoms, and that it will be making self-collection kits available to the consumers in the coming week. So one test of this will cost $119, and consumers who have to pay out of pocket for the test then ask their insurer for reimbursement afterwards. And so at the moment, when governors across the country are facing a shortage of tests, people now don't have to go through a drive-through testing once this is made easily accessible to consumers. Medical experts also said that it could increase convenience for the consumers, but some also say that nasal swabs can be less accurate for testing than the standard specimen collection for the coronavirus that health providers perform, which they involve inserting a long nasal swab up through the nose into the back of the throat. But obviously that is extremely painful, and a nasal swab would be much more easier and comfortable for us patients that get tested. So the second thing that I like to talk about today is that for the American department stores, the virus was just the last blow to decades of weakening. So in the past decade, American department stores have been weakening. JCPenney and Sears were upended by hedge funds. Macy's been closing stores and cutting corporate staff. And Barney's New York filed for bankruptcy last year. However, nothing compared to the shock the weakened industry has taken from the coronavirus pandemic. The sales of clothing and accessories fell by more than half in March, which is a trend that is expected to only get worse in April. And many stores, including Nordstrom, has canceled offers and putting off its vendors. American department store chain Neiman Marcus Group is expected to declare bankruptcy in the coming days. And this is not going to be the last store. So, at a time when retailers should be putting in orders for all the holiday shopping seasons, stores are basically laying off tens of thousands of corporate and store employees, hoarding cash and desperately planning to survive this crisis. And no one doubts that the upheaval caused by the pandemic will permanently alter both the retail landscape and the relationship of brands with the stores that sell them. So that's, I think, the American department store is very unlikely to survive, and the ones that do survive, if there is any, will probably be extremely weak when they do survive. So the third thing that I like to talk about is that antibody tests show that the number of cases of infections is higher than expected. Studies performed in Santa Clara County, where I live, and Los Angeles County both estimate that the number of people infected countrywide were far higher than the number of confirmed cases. So in Santa Clara County, researchers tested 3,330 volunteers, and roughly 1.5% were positive. So with this, in the end, with the sample and the population of the county, this means that researchers estimate the prevalence of antibodies fell between 2.5% and a bit more than 4%. Since antibodies mean infection and immunization, this means that between 48,000 and 81,000 people were infected in Santa Clara County by early April. In Los Angeles County, researchers also conducted antibody tests and estimated that between 2.8% to 5.6% of the country's adult population carried antibodies. If this is accurate, that would mean 220,000 to 442,000 residents have been exposed, but only 8,000 cases were confirmed in Los Angeles County when the testing was done. So if the numbers of all these studies proved accurate, the virus might be much less deadly than originally expected, and the fatality rate more closely resembling that of a bad flu strain, especially. I personally think that the number of actual infections is probably way higher than the number of confirmed cases, because after all, I mean, this virus spreads extremely easily by air, by person to person, and as a result, I think this virus has probably spread further than we can ever imagine. And so that's it. Thank you for listening, and I hope you have a good day.